I'm Nathan. This is the AR Minute from AWE EU, and I'm here with Julia Kern from Somareality. Let's get started. Can you tell me a little bit about who you are and what you do in the metaverse at Somareality?
We develop digital biomarkers for virtual reality, and that sounds really, really fascinating, and at the same time maybe a little bit confusing. So at Soma we actually have two units that we run. One is custom solutions for anything basically in virtual reality, but we had a big focus on healthcare in the last few years. And the second is Somareality, which is a suite for developing digital biomarkers in digital environments. Our first product is measuring cognitive load with the hopes of really trying to understand human behavior in VR. So we're going in the direction of trying to really measure attention, and attention is a big buzzword in VR, AR, XR, whatever.
Marketing.
yeah, everywhere. But with cognitive load as being our first algorithm and also like a first product to eventually license, we're really hoping to get closer to whatever else there is that we want to work into this whole equation that is attention. So we're looking at stuff like obviously gaze tracking, heat maps and all of that, but we're really focused on eye tracking based on pupil dilation to get to the information where we want to get, because we follow a kind of laboratory that fits into a box approach, where we really don't want any other external sensors, which we would need in order to be able to measure other digital biomarkers. We just focus on eye tracking for now because we want it all to be like a one-box-fits-all solution.
We heard today from Ori on the main stage a lot about dreams for the metaverse. Can you tell us a little bit about your dreams for the metaverse?
Part of our business focuses on developing custom solutions and digital biomarkers for the healthcare industry. And this is really where we see ourselves headed. And the dream here is to really leverage the technology that we have at hand right now and to see where this goes and everything, and tie that in with the problems that we're facing currently in the healthcare industry, with everything ranging from, maybe not so personalized patient care to lack of efficacy in some areas, and to really bring that together to create more feasible, sustainable and patient-centered solutions in the digital therapeutics field. That's a mouthful to say for an Austrian and a German native speaker. Second is a more personal one, because as a woman in the tech sphere, I just really hope that the advent of this new technology and new field will help us propel diversity, equity and inclusion further. And sitting with you here today is a really good sign of this happening, you and me here talking to you guys out there. So I really hope that you all carry this message forward.
This kind of technology is sort of at the center of a bit of controversy or concern. As somebody who is building tools around humans in the metaverse, what should we do about these sticky questions around ethics, around our data, around access to these kinds of tools? And how do you approach that in your work as you're building out these new ideas and technologies?
So as a European, I'm primed to answer this question also in two ways. One, and actually, I don't want to make this sound easy, but at the same time, I feel like the question around data privacy and all of that, it's been around even before the advent of VR and all of this technology. It concerns other fields as well. And I feel like there's a relatively easy solution for that, in the terms of, before you go into a use case, you just have to know, who the data belongs to, who it's going to be shared with, and establish sort of like a consent system. I know it's really easy for me to sit here and say all that and not be working directly in the healthcare industry as a provider and whatnot. But I really feel like if we talk about this before going in, and we have so many learnings from other industries already, then we can really leverage the best of it and try to mitigate the risks of data being shared where it shouldn't be shared. That's the one. And to put this on a meta level, the whole discussion around ethics goes back to us being decent human beings. I mean, you can't control what other people do, but at least at Soma, we really try to protect, and respect data privacy and all the other sensitive issues that are tied with it. Obviously, you can't take my word for it, but watch out for us 5, 8, 10 years in the future. We'll still keep our promise.
You've made it to the last question. Congratulations. It's simply a fill in the blank, and it's the future is?
I want to say hybrid, because I feel like this is where we lose a lot of people outside of this bubble that we're just now sitting and talking in. People outside of this bubble, and that concerns my friends, my family, everyone who isn't working AR, XR, VR. they think that the metaverse will substitute their life as they know it. And that's just not the case. I feel like it's just going to enrich life and benefit life as we know it, just as smartphones have over the course of the last 10 years. But it's not necessarily going to substitute it. And I think so hybrid is the word I would go with.
Yeah.
Because I would hope that we will find a way to let technology, the hardware, the software and everything intertwine with what we already do and let us do it even better. Is that an expression? Let's go with it. No, and I really hope to see other enthusiasts go with that here at AWE, and I feel it's the perfect playground for that.
Well, Julia, it has been such a pleasure to chat with you. I'm so excited to see what Somareality is doing. Can't wait to get a little bit more view on it at the expo later today.
Yeah, please come by.
Yes, that was so fantastic. Thank you.
Thank you for having me. Thank you, guys.